Woodhouse.
Mr. Speaker, last year during the financial review of the Health Select Committee of the County's Manukau DHB for the 08-09 financial year, there was a single comment made by the Chief Medical Officer about doctor productivity that I think summed up the tangle that the New Zealand public health system had got itself into at that time. And he pointed out that they'd done an analysis into doctor productivity and the measurement of patient contact time by their specialists. And in 2000, I think it was, a specialist at Middlemore Hospital spent about two-thirds, 67%, of the working week in front of a patient. Now, by the end of 08-09, that proportion had fallen to below half of their working week. I think it was about 47%. Now, I've got no doubt that some of that was necessary and well intended, but at a time when the doctors at Middlemore were already spending a third of their time away from patients, when there was a massive injection of cash that led to about 900 more Ministry of Health staff and about 3,000 DHB staff in departments like funding and planning and IT and data gathering, some of which should have meant less paperwork for doctors. Despite all of that, doctor contact time with patients went down massively. Billions of dollars were poured into Vote Health, but services in real terms were static and in many areas were dropping. And doctors and nurses and allied health professionals were becoming increasingly frustrated at the red tape that prevented them from doing better. And they were telling me that they were becoming and feeling increasingly marginalised from the decision-making process in their public hospitals. That they really wanted to improve the quantity and the quality of the care that they were providing for their patients, but they were being prevented from doing so. And yes, it's about more bang for the buck. I make no apology for the comment that was made by my colleague. Whatever you call it, value for money, it's the responsibility of any government to make sure that those resources are spent in the right places. This government has pushed resources from the back office into the front line, and the opposition might scoff at what that means, but the results have been, by any measure, astounding. Surgery is something that I know pretty well, and it's been static at about 125,000 per year for the last 10 years. In the first year under the national government, it went up by nearly 13,000. And that's on a very small increase in the baseline relative to what they had been getting in previous years. Chemotherapy treatments, very, very good improvements in the timeliness of patients getting chemotherapy. Publicly funded chemotherapy clinics are up by a quarter, by 20%. Emergency departments are seeing their patients faster. 80% of them before this government came to power were getting out of there within 6 hours. It's now 87% and climbing. And that's because the doctors, the nurses, our allied health professionals are now feeling more re-engaged, more involved and more listened to when it comes to decision making in their DHBs. So we're already on that journey, and this bill just continues that process. I want to just talk about the planning issues, because I really have to laugh at the concerns, frankly, that these changes are going to make to the public consultation in the planning process. I don't know if anybody's been to one of these planning meetings, but I used to go to them in the Otago area, and I can't remember a public meeting around the annual plan for the Otago District Health Board that had more than about 12 people in it. The fact is, the process was more about process than it was about outcomes. One could pick up one of these plans and read it and be none the wiser about which DHB it was for, because they were so generic. So I think these are really good improvements that are going to improve the quality of the planning and hopefully make them much more meaningful to the individual communities that they're meant to represent. So this is a good bill, Mr. Speaker. I think there's a few things that we still need to talk about in the committee stage, but I look forward to its progress and I commend it to the House.